Well, this is Mark here. So Mark has been coming to me. Well, I'll have you, tell us, Mark, what we've been treating you for.
Well, when I walked in the door, I was having trouble walking without a severe limp, and I had severe problems. I could not move my neck from side to side, and Dr. Shemansky absolutely is a genius. He fixed all my problems. I still come to see him because I still need adjustments, but without him, I'm not walking like I'm walking. I'm not looking. I'm not playing golf. I couldn't play golf. I now go play golf twice a week.
All right, that's great. Well, the biggest issue that you had with your neck was, the inability to turn his neck left to right. So we have most of the range of motion back from Mark. So, so we're going to walk you through of what we do for patients that have neck pain, arthritis in their neck, and also, of course, loss of range of motion, because that's kind of important, especially down in Southwest Florida when we're trying to drive around here. So the first thing that we do for Mark is have him turn to the right side for me, Mark, as far as you can. And right now, Mark's moving pretty well. We have him turning about 70 degrees, almost 80. 80 is about normal for rotational of the neck. Let's go to the left side for me, Mark. Here, he's hitting almost 80 degrees on this side. When he first came in, we were around like 35 to 40 degrees.
If that much.
If that much, huh? So today, we're actually going to do what we typically do for our patient with neck issues. Is we're going to palpate him first, and then we will adjust the neck on the upper cervical region here. So first segment that we will adjust is the C2 on the left side. All right. And this is what we call Gonstead cervical neck adjustment. It's one of the least invasive. It looks very invasive, but it isn't. It actually places very minimal amount of stress on the joint with much less rotational components when it comes to the neck being adjusted this way. So all we have you do is bend to this side and stay right there for me, Mark, and relax your shoulders for me. Good, all the way through. Good job. And we usually double check it, and then we're gonna actually go to the right side to C5 and have you bend all the way down to the right side for me, Mark, right there, and relax shoulders. Gotta keep it. Good job. And after we reset the joint, we usually do a lot of myofascial release and trigger point release, and do a lot of what we call PIR and PFS, which are basically soft tissue mobilization techniques, which does sometimes give Mark some discomfort and pain, but he's pretty tough. He can take it. So let's have you turn to the right side for more, Mark, as far as you can, and resist against my hand here, sir. Good. And go to the right side again, Mark, as far as you can. Good. And you can see how we're trying to release the muscle after we reset the joint to get more mobility in the neck. And resist against my hand here, Mark, please. Good. And turn right for me, Mark, as far as you can. Nice job. Keep pushing left for me, please. And go right for me, sir. Push left one more time. And go right for me, Mark. And go ahead and look down a little bit for me. And we're going to stretch some of the scalene muscles, the trapezius muscle, and some of the levator scapular muscle here too, to release these guys. Good job. All right, let's have you turn to the left side for me, Mark, as far as you can. Good. Keep your shoulders back for me here. We stress no cheating when you turn, because typically when patients turn and when they have a lot of neck pain, they oftentimes would turn their neck and they move their shoulder with them, and that really doesn't show an actual natural movement of the neck. So we want to always have them keep the shoulder back and then just turn their neck so we can see where everything is. Let's have you push and resist against my hand here, Mark. And I'm going to release the proper muscle to get in more movements here. And go to the left side again for me, Mark, as far as you can. Good. So you can see his nose is where we measure him, is right above his shoulders, which is almost 90 degrees. And that's pretty good. 80 degrees is normal for a 25-year-old or a 75-year-old patient. So Mark's doing pretty well. All right.
Pretty well.